We check patients' vital signs like temperature and blood pressure to see whether there are any physical problems that may not be clear from visual assessment. Similarly, we think of a brief assessment for depression as a vital sign for our patient's mental health. Just as thermometers and blood pressure cuffs are our tools to check physical vital signs, the Patient Health Questionnaire 9, or PHQ 9, is a tool used to screen for depression. The PHQ 9 should be administered to all patients at least once per year. For patients with known or suspected depression, it can be given at every appointment. The 9 refers to the number of questions, and each question addresses a common symptom of depression: decreased enjoyment in things, feeling down or hopeless, sleep problems, low energy, changes in appetite, feeling like a failure, problems concentrating, feeling restless or moving more slowly than usual, and suicidal or self-harm thoughts. The patient is asked to consider these questions based on how things have been occurring during the past 2 weeks, and estimate the frequency of symptoms as none at all, several days, more than half the days, or nearly every day. Each question is scored from 0 to 3, with none at all receiving a score of 0 and nearly every day receiving a score of 3. There's actually a 10th question, which isn't part of the total scoring, that simply asks the degree to which these symptoms have interfered with daily life, ranging from none to a little to a lot. This 10th question helps us to understand how well or how poorly the patient has been coping with these symptoms. When the patient fills it out, you don't have to emphasize that the questions are looking for symptoms of depression. This can potentially affect how someone considers the questions. It's better to say something like, "We just want to check how things like sleep, appetite, and energy have been going for you over the past couple of weeks." Just like we don't just check vital signs the first time a patient comes into our office and then forget about them, the PHQ 9 should be part of the routine screening during follow-up visits. If a patient has started receiving treatment for depression, including therapy and/or medications, regular screening with the PHQ 9 is a good way to help track progress and make sure that the treatment is effective. And just like we have ranges and cutoff values to gauge whether someone's blood pressure is low or normal or high, the PHQ 9 score has ranges that indicate whether depression appears to be present, and if it is, where it falls in the range from minimal to severe. Scoring the PHQ 9 involves nothing more than some basic math. With each question scored 0 to 3, the highest score possible is 27. A score of 0 to 4 indicates none to minimal depression. At the other end, anything in the range from 20 to 27 is considered severe depression. If question number 9, the one about self-harm and suicide, is answered with any degree of a positive answer, this needs to be explored further, regardless of the answers on the rest of the survey. There is a PHQ 9 version for teens. The content of the questions is very similar, but the scoring is a little different. If it's easier to use the same version for all of your patients, regardless of their ages, the results will still be valid. And parents can answer the questions on behalf of younger children based on what they have been observing at home. A PHQ 2 also exists. This is basically just the first 2 questions of the PHQ 9. This is obviously shorter and easier to administer. If a patient scores 3 or higher, the maximum possible score being 6, then it is concerning for the presence of depression, and the full PHQ 9 should be administered. Because the PHQ 9 is a more thorough approach, it's the recommended one. But if a clinic is especially busy or patients are being seen for frequent follow-ups, the PHQ 2 might make more sense and increase the likelihood that the screening will get done. The PHQ 9 is not meant to allow you to provide a definitive diagnosis of depression, but it can identify symptoms and signs of depression that a patient may not be willing or able to share during a medical appointment. It's a bridge to starting a conversation about a patient's mental health. From there, you can assess the situation further and determine what treatment or referrals might be needed. The links for the PHQ 9 and all the other tools used in this course are included in the course handbook, so go check it out.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.